Anemia is an important health concern that requires proper diagnosis and treatment to prevent complications. In this presentation, you will get to know more about the causes, symptoms, and classification of anemia. Anemia is a deficiency in either the number of red blood cells or the amount of hemoglobin, the oxygen-carrying protein, within those cells. Specifically, it involves a decrease in hemoglobin, hematocrit, and the overall red blood cell count itself. These reductions can have various causes and lead to a range of symptoms depending on their severity and underlying reason. Remains a critical global health challenge, affecting 1.6 billion people worldwide, representing 24% of the world's population. The burden is highest among vulnerable groups, with 41.8% of pregnant women impacted. These WHO-endorsed statistics for anemia underscore the urgent need for targeted interventions. Blood consists of 4 key components. Red blood cells, or RBCs, contain hemoglobin for oxygen transport. White blood cells and platelets work together to protect the body from infection and control bleeding. Plasma, the liquid portion, carries water, electrolytes, and vital proteins throughout the circulatory system. Together, these components maintain homeostasis and support all bodily functions. Red blood cells have a unique biconcave structure, flattened discs with depressed centers. In this section, the structure of red blood cells will be explained more. Hemoglobin is a protein found in red blood cells and consists of 4 heme groups. Each heme group contains an iron molecule that binds oxygen, giving hemoglobin its ability to deliver oxygen to the tissues. Hemoglobin levels vary based on factors like age, sex, and pregnancy status. For men, the normal hemoglobin range is between 13.5 and 18 grams per deciliter. For women, it's slightly lower, ranging from 12 to 15 grams per deciliter. Children typically have a range from 11 to 16 grams per deciliter. During pregnancy, hemoglobin levels are often higher, with a normal range of over 10 grams per deciliter. These values are essential in diagnosing and managing conditions like anemia, where hemoglobin levels may be outside of the normal range. The process of oxygen transport begins in the lungs, where oxygen enters the blood and binds to hemoglobin in the red blood cells, forming oxyhemoglobin. As blood circulates to tissues and organs, oxygen is released from hemoglobin and delivered to tissue cells. This process is vital for maintaining cellular functions and overall body metabolism. The bone is composed of 2 main types of tissue: spongy bone and compact bone. Spongy bone, also known as cancellous bone, has a porous structure. Compact bone, on the other hand, is dense and forms the outer layer of the bone. Within the bone, especially in the cavities, is bone marrow, a soft tissue that plays an important role in hematopoiesis, the process of creating blood cells. Bone marrow is responsible for producing red blood cells, white blood cells, and platelets, which are essential for oxygen transport, immunity, and clotting in the body. When the body experiences low oxygen levels, a process called hypoxia, the body activates the hypoxia-inducible factor, HIF, which adjusts to these conditions. In response to hypoxia, HIF becomes active and binds to specific regions of the DNA near the erythropoietin EPO gene. This binding triggers the activation of the EPO gene, causing the production of erythropoietin. It is then released into the bloodstream, stimulating the bone marrow to produce red blood cells, ensuring that the body can efficiently transport oxygen to tissues and organs. Erythropoiesis involves several stages, starting with the megakaryocyte erythroid progenitor, which is the earliest identifiable precursor to red blood cells. As the process progresses, the cell undergoes several key stages: the pro-erythroblast stage, where the cell begins to specialize in red blood cell formation; the early erythroblast, where hemoglobin production begins; the intermediate erythroblast, which continues the development of hemoglobin; and the late erythroblast, where nuclear extrusion occurs. Finally, the reticulocyte is the immature red blood cell that enters circulation, where it matures into a fully functional red blood cell. This entire process is tightly regulated to ensure an adequate supply of red blood cells to meet the body's oxygen transport needs. 3 primary mechanisms can cause anemia: acute or chronic blood loss, increased red blood cell destruction, as seen in hemolytic disorders like sickle cell disease, and impaired RBC production, which occurs in nutritional deficiencies or bone marrow failure. Each pathway disrupts oxygen delivery uniquely, leading to anemia. Reticulocyte count splits anemia into hypoproliferative, that is less than 2% poor production, and hyperproliferative, that is more than 2% active response. Microcytic anemias feature RBCs smaller than normal size. Normocytic anemias maintain normal RBC size but reduced numbers. Macrocytic anemias involve enlarged RBCs. This size-based classification directs targeted diagnostic testing. Anemia is systematically classified by proliferative response and RBC size. First, hypoproliferative microcytic anemias, featuring small RBCs, include iron deficiency, the most common global cause, and thalassemias with their characteristic hemoglobinopathies. Next, hypoproliferative normocytic anemias encompass anemia of chronic disease, driven by inflammatory cytokines, and aplastic anemia from bone marrow failure. The hypoproliferative macrocytic group involves vitamin B12 or folate deficiencies impairing DNA synthesis, alongside refractory anemias. Finally, hyperproliferative hemolytic anemias split into extravascular hemolysis, where macrophages destroy RBCs, and intravascular hemolysis with direct bloodstream rupture, each requiring distinct management. Anemia presents through a spectrum of symptoms directly tied to oxygen deprivation. Early signs include weakness, the most common complaint, along with pale skin, dizziness, and short breaths. As severity progresses, patients develop chest pain resembling angina due to myocardial hypoxia. Neurologic manifestations like restless leg syndrome may also occur.